The third wave of the coronavirus is having a major impact on the healthcare system in Nigeria, with the isolation centers already recording a high number of patients. In this report, TVC News senior correspondent Sharon Ijason reiterates the need for people to be more responsible as the third wave hits harder.
Africa's fragile health system is a source of concern as COVID-19 pandemic spreads more. From reports, poor surveillance leads to underreporting of COVID-19 associated outcomes and deaths. In Lagos, the epicenter of the pandemic in Nigeria, there is growing concern over poor adherence to the COVID-19 safety protocols, despite a lot of awareness campaigned by the government.
Just information that
the State Commissioner for Health, Professor Akin Abayomi, stresses the need for people to get vaccinated and desist from stigmatizing people that might contract the virus.
So we have a large number of mutations in the virus that is changing it and causing us to identify that COVID has now changed into these different variants or strains.
With the growing need to strengthen infectious disease surveillance mechanism in Africa, I had a chat with the Administrator Private Sector Coalition Against COVID-19 CACOVID, who spoke about interventions and efforts to boost international collaborations.
CACOVID supported testing in the beginning last year. We partnered with the UN Basket Fund to bring in vaccines to testing supplies for Nigeria. So we did that. Right now, there's not really a testing challenge. It's more, let's make sure that the vaccines exactly are, as they're coming in, that they're ending up in people's arms.
In a quest to know more about how public hospitals in the country are responding to the pandemic, my team and I visited the Lagos University Teaching Hospital in Yaba, Lagos. A chief infectious and community health expert spoke with us about their experience during the first and second waves. According to them, there was a time the B wing was empty, but now the first floor is filled to capacity. This expert wants the public to adhere to COVID-19 guidelines as the new strain of the virus is 6 times more infectious.
COVID-19 is real. It's not a hoax or a scam. Like some people still don't believe that it's real.
This place was filled up from, beginning, down to the end. In the second wave, of course, because we changed our approach. We're only admitting people who are sick. We, again, from top to floor was filled up, and we also had to dedicate an ICU for management of those patients.
Although the recorded cases may seem low, it's been forecasted that Africa will suffer the most effects of the virus after the pandemic is over. Simple procedures such as regular washing of hands, regular exercise, getting vaccinated, eating right are some of the things that can be done to curb the spread of the virus. Sharon Ijason, TVC News.